Well, hello everyone. This is Chris with the Ancient Scholar. I've got some good news today and some bad news today. The good news is that I took the Certified Respiratory Therapist board examination um, and passed it. So I am now a CRT. Uh, I think that's good news. The bad news, however, is I have two more exams to get through. One, the clinical sims, unfortunately has a very high rate of failure, a first-time fail rate. So certainly I'm not having any anxiety over any of those. Hopefully by next week I'll start tackling them. Okay, so what I wanted to talk about is just to do a quick review of the CRT. Now, I cannot talk about specific questions that I encountered, or I can, but I won't. First of all, the National Board of Respiratory Care doesn't particularly like you discussing their exams, and you actually have to sign an agreement saying that you won't. And secondly, it's just dishonest, just academically dishonest to do that. And certainly here at the Ancient Scholar, we're about doing things honestly and properly. But I will go ahead and give a rundown in kind of my general experiences of the CRT, just to kind of help people out who are a little anxious over this exam. Certainly some of my classmates that will be taking this exam here in the next couple of days. So this is what I encountered. The examination is 160 questions long. 20 questions are what are known as pilot questions. They don't count for your grade. They're just out there. They're piloted to basically see how people do on them on the average. So some of those questions can be really crazy, and if you get a question that just seems really different, really odd, specifically hard from some of the questions that you've encountered, it's probably one of these pilot questions. So don't allow that to trip you up, because again, you get 20 questions that don't count for anything. So really only 140 questions count. The next question a lot of people ask, well, what is passing? Well, passing is very relative when it comes to the CRT exam. The CRT exam is based on what they call scaled score units. So passing is very relative in that if a certain exam or certain questions that you receive were particularly hard, your overall passing score may be significantly lower than somebody else's. Now, the passing score is always going to be 75 scaled score units, but that doesn't necessarily mean 75%. For example, the test that I took, I ended up having to get 86 correct answers out of 132, which would put about a 63% as a passing score, but that percentage ends up being 75 scaled score units. So it's based on how hard kind of the questions are that you encounter. So there isn't a fixed percentage that you'll pass off of. It's really based on the kinds of questions that you'll get. So don't use that. Don't take that 75 as a literal. Oh, I need a 75% of all the questions. It's not that way. You actually may need to score higher than 75% or lower than 75%, depending on how the test is scaled. Okay, so that's a first big point. The next big point, the test is divided into three general content areas. There's patient data evaluation and recommendation, and this is things like going through the record, how to collect proper information, what kind of information to correct, and recommending certain procedures. Does a certain test or a certain assessment need to be done on a patient that's presenting a certain way? Pretty straightforward for the most part. Part two is equipment manipulation, infection control, and quality control. I ended up having about 29 questions on this section and 26 questions on the patient data. So certainly equipment manipulation is a very big portion of this test. This can include things like CPAP, BiPAP, ventilators, IPPB, aerosol masks, air entrainment masks, heat and moisture exchangers, wick and cascade humidification, things of that nature. I did encounter several calculations. This is actually had to do a fair amount of math on this test. Things like the VDVT calculation, static compliance, cylinder duration calculations, a total flow from an air entrainment system, the magic box calculation that they talk about. I actually had to do all of those, and you should expect those calculations on the exam. There are some shortcuts that some of the review courses teach, like instead of 3.14 for an H cylinder factor, you can use 3, and that'll get you close to the answer. I actually found that those shortcuts were not helpful on the exam I took. There were a couple questions where the answers were close enough that I ended up having to go back and recalculate using the actual factors or the actual constants instead of the shortcuts, just to find out, the answers were that close. I won't go into any more depth than that, but anecdotally, I would recommend not using the shortcut. Just learning how to do good math and actually doing your calculations the right way, because I did run into that issue. Okay, the third general area or content area is the biggest, and I had about 85 questions, and this is on initiation and modification of therapeutic procedures. I had a lot of ventilation questions, where you get a scenario, a gas, ventilator settings, and you would have to recommend changes based on your assessments. What I found was that the answers included answers that I didn't really like. There wasn't the textbook answer that you're used to. There were a lot of questions that were a little bit more ambiguous, and maybe you were having to choose the least incorrect answer is kind of how I look at it. Is okay, which I don't like any of these answers, but I'm going to err on the side of safety and either go with maybe a more conservative route or the least incorrect answer. So you really have to have a good handle on equipment. And again, even though equipment is section 2, really modifying a therapeutic procedure section, the one where I got 85 questions, it's all equipment. It's all equipment, I'll be honest. Ventilators, big on IPPB, CPAP, BiPAP, and then the nomenclature they use, the different nomenclature. They won't use a whole lot of trademarked, like BiPAP. You won't see BiPAP. Because it's a trademark name. You might see non-invasive positive pressure ventilation, and that might be a keyword that they're talking about, BiPAP in that case. So you really have to know the generic names for a lot of these things. So again, manipulating ventilators. If somebody has a high CO2, how do we correct that? What ways can we correct that in both pressure and volume control ventilation? Really have a good handle on what flow does. What happens when I increase the flow? What happens when I decrease the flow? How does that relate to manipulating the ID ratio, the I time, the E time, oxygenation, ventilation, all of that stuff. So this exam, I guess in conclusion, was pretty technical. Not that it was necessarily insanely hard. Was technical in that there were a lot of calculations, and there were a lot of questions about interfacing with equipment and how do I interface with that equipment when it's hooked up to a patient. Again, if any of you guys are in my respiratory class, we took what was called a self-assessment examination at the end of the semester to graduate. This is very similar to that SAE. So that's actually about how hard it is. So it's probably a little harder than I expected. But again, I don't want you guys to worry. I'm not a genius. I'm not the smartest guy in the world, and I did just fine on this exam. In fact, I actually did 10% higher on this exam than the SAE, and I would expect most of you would probably add at least 10% and that's what you'll end up doing on the CRT. So it's probably not as hard as some of the tests we've taken in school. It just seemed harder because it was very long and because there are all these pilot questions that were just crazy. And as it turns out, all those questions that I was just sweating about when I was taking this exam, it doesn't look like any of those questions counted against me because I scored exceptionally well, and I certainly didn't feel that way. So anyway, that's my take on the CRT exam. Just, be anxious, but don't be paralyzed with fear. When you take your picture, it will take your picture. Do something stupid. You don't want a real serious picture. And I'll just throw my little picture up here. Here I'm striking a nice little pose in my hand and just being silly, just to kind of break that air of concern and worry up a little bit. Okay, guys, so those are my first general impressions. Hopefully you find this helpful. Anyway, take care, and good luck if you're taking this exam. Bye-bye.